weather events have become very increasingly unpredictable. You have very extreme cold, or sometimes the weather is so hot and unbearable. We have wildfires, we have floods happening. Some vulnerable populations are especially even more affected. So we did research in northern Ghana where we looked at the relationship between floods and how it affects health. And what we found was that when floods occur, people are not able to access healthcare, especially pregnant women and children. And the healthcare workers themselves are not able to access the health facilities to provide care. Also, when the floods occur, the flood waters contaminate drinking water sources, and the communities go back and use these water sources for drinking and cooking, and this leads to disease occurrence such as cholera. So through the data we analyzed, we found that when floods occurred, these diseases actually go up. This kind of findings, we engage with communities, healthcare workers, and people who plan health facilities so that we make health facilities more resilient in terms of we have to think critically about where we build health facilities and how we build them, so that if some of these unavoidable events or unpredictable, events occur, we are able to safeguard people's health. People are still able to make that journey to a health facility. The flood does not destroy all the medicines, infrastructure, and supplies in the hospital. So we use this kind of information to make the health system more resilient through planning and making decisions that are better for communities. If you think about pregnant women, their unborn babies, newborn babies, children who are in their early ages, if anything happens to them, they carry it along their whole lifetime. So these are especially vulnerable populations that are most affected by the climate crisis. We are using the research findings to engage with communities, stakeholders, and people who make decisions so that we are able to better anticipate climate shocks before they happen. And when they do happen, we are able to adapt quickly and limit the impact it has on people, particularly vulnerable pregnant women accessing care. The research is really important for us to identify where this is happening and who is most impacted. But then it's really important to get this information into the right hands of policymakers, healthcare agencies, Ministry of Health, so that they can use it to make the right decisions for health systems to be more resilient and to improve the lives of the vulnerable population.